one of the single most amazing abstracts at the ASCO meeting is one by Dr. Weber. And we talking about how this molecular revolution has totally changed what we thought was true and what we thought was what we were taught going to oncology school. And one basic tenet is of combination therapy is that when you add drugs together, the toxicity of each drug will be added. It only makes common sense. And I would have, if I met with a trainee, I would immediately say that this is what to expect. You give 2 drugs, you're going to have more toxicity. Well, what they have found in melanoma is that when you add a BRAF inhibitor to a MEK inhibitor, both of which have their own sets of toxicities when you give them alone, when you put them together, the toxicity goes down. Toxicity goes down by giving a second drug. It's exactly the opposite of what we were taught. And important toxicities. One of the toxicities, unfortunately, from the BRAF inhibitors like vemurafenib are cancers of the skin cancers, which can be managed, but obviously you don't want to have another set of issues to deal with a person already fighting melanoma. But when it's found, when you add the 2 together, the incidence of skin cancers drops dramatically, and the drugs themselves are better tolerated. So this molecular revolution has taught us that we need to be re-educated as to what is possible and what is true. And again, it's another really potent example of the kind of changes that we're seeing that were highlighted here at the ASCO meeting.